What happens on the day of surgery for a patient?
Usually they're coming in fairly early in the morning, and our system is a fairly well-oiled machine, so they move through the steps fairly quickly. So they're initially brought into our pre-op area, and they meet our anesthesiologist, who usually does some level of anesthesia in the pre-surgical area, which is what we call a nerve block, which will help their pain after surgery for 2 to 3 days. And then we usually bring them into the operating room once we've made sure that they're ready for surgery, make sure nothing's changed since we saw them last, and make sure all the appropriate paperwork is filled out. Then once in the operating room, we induce the anesthesia, which is usually a spinal anesthesia, which allows us to lightly sedate the patient during the surgery, but don't put them fully asleep. And then we perform the total hip or total knee replacement, which can take anywhere from 1 to 2 hours based on the surgeon and based on the patient. And then once complete, the patient goes back to the recovery room and starts the recovery process.